Welcome to the Right Tack, where we help private practice owners face the headwinds of the healthcare industry. I'm Paul Jonas, CEO and co-founder of BreezyBilling and Phoenix Credentialing.
I'm Jim Jonas, therapist, co-founder of BreezyBilling, Phoenix Credentialing, and the Jonas Center.
And today we have with us Carrie Ripley. Carrie, what do you do?
I am the Director of Operations for BreezyBilling and the President and co-founder of Phoenix Credentialing.
Yeah. All right. Glad to have you on the show. Today we are talking about the 10 major steps of starting a private practice. All right, let's dive in. Today we're talking about what it takes to start a private practice. But first, Carrie, we asked this of all of our guests, and right now you're our first guest on the show.
Wow, yeah.
And we always want to find out what you're up to this weekend. So what are you doing this weekend?
All right. This weekend, I am heading out of town with a friend to go to her cabin.
Oh, it sounds like a blast. How about you, Dad? What do you got going on?
Well, it's Father's Day.
Oh, yeah.
And I've got this big smoker that I got for Christmas. So I think we're going to be smoking some meat.
Well, and if it's Father's Day, I guess I'll be right there with you. So I really can't wait.
Yeah.
But it's also my son's 15th birthday. So we are going up to the cabin with a couple of his buddies and planning to fish the whole weekend. So that should be pretty fun.
Yeah.
Even had to rent an extra boat. So we'll see. We might be able to borrow one.
Is it a sailboat?
It is not. Nope. It is a motor boat.
Okay.
So today we've got Carrie on here. She's the director of operations here at Breezy. And I don't know, how long have we worked together, Carrie? That's probably a real good question. It's probably been.
Let's see. I've been with BreezyBilling for over 3.5 years, and I've worked with you for 5 years before that.
Probably.
Yeah.
Sounds like 8.5 years.
Yeah.
Wow.
I'm so sorry.
It's tough.
Hey, here I am.
I'm sorry for you too, Carrie, working with him. I understand. Yeah.
There's a reason we didn't put you between us. It'd just be stereo Jonas. And that'd be trouble. So you're working on our documentation procedures. You're helping our employees, just trying to reduce frustration and generally kind of grease the gears here at Breezy is really your role. That's all fun, but in your free time, what do you like to do?
My favorite things to do are to go hiking with my kids, tour national parks. They're both adults, and get outside as much as I can. My favorite thing this time of year is golfing.
How often do you golf?
Not often enough.
That's the right answer.
And we had a bet, and I think it was an extended weekend bet. Like I'm trying to figure out if you can get to 100 holes in a weekend. Was that what this is from a few years ago?
That was what you bet me to do, and I think I never made it past 72 in a 3-day weekend.
Oh my gosh! So close. Wow. You could do it. Just two rounds a day. We've done the math. I can't think of it right now. So then how about your latest adventure? I mean, I guess I know what it probably was, but share with the people what your last adventure was on the hiking and travel front.
National Parks tour with my sons, as well as going to a wedding in Hawaii. So we got to see Kilauea erupting. It was a great trip.
Oh, that's cool. And the thing that I don't know, I was fascinated by the lava tubes. That was and Carrie sent us some pictures. I don't know if how that works with podcasts, but there's some really cool pictures of Carrie and the boys in the lava tubes.
Walking in lava tubes.
Inside
it's amazing.
Gigantic lava tubes.
It's like a giant wormhole or something.
Yeah.
It's weird.
Yeah. Very cool.
So, so today we're talking about starting behavioral health practices. And this is just going to be a super high level view of what a mental health provider needs to think about when they're starting a practice and take into consideration. One of our jobs here, or one of our missions, I guess I should say, at Breezy is to keep behavioral health independent and really help folks who want to start and run and grow their private practices, their clinics, whatever you want to call it. And so it gets harder and harder because compliance is getting harder. There's more. I don't know. We've seen all the whole industry evolve. Quite a bit. I guess for me, I've been doing this for 10 years. So at least in the last 10 years, it's gotten harder and harder. And so we're trying to help out and get people to start those practices because with a little bit of guidance, it's not it's not as scary as you think, or at least with some trusted guidance. And so we want to be those trusted guides. And so we've asked Carrie to come on and talk a little bit about we broke it down into 10 steps of how to prepare to open your doors to clients. So Carrie's going to be helping us out with that a little bit today. So let's get started, I guess. And this stems from a lot of the conversations we have with our customers, prospects, and just making sure that they have all their stuff in order or get all their stuff in order if they don't. So I don't know. How do you want to get started, Carrie? You want to just start with number one here?
I think that's the best thing to do. Absolutely.
Right. And the first thing I know when I'm talking to prospects, just people who are looking to get practices started, whether they're coming from a group or they just got their license and have always wanted to start a group or start a practice, I call it the numbers talk. And that's just because there's so many dang numbers involved. And we're going to try and do this in order, although a lot of this all can happen at the same time. But the first numbers you need is an address. So you got to find some kind of office space. And the hard part about that is that office space can be expensive, and you're usually looking at needing that address for the first for probably about 6 months before you really start making any kind of revenue, any kind of serious revenue. So there's some different options that are out there that we always talk about. And so there's like co-working space, there's virtual office, which are kind of similar. Otherwise, we have folks who rely on colleagues where they pay a little bit a month to just kind of do a little mini sublease on some space. And really the main goal with the insurance companies as you're doing this is that there's a physical location where you can see a client if need be. It's really hard to get contracts if you're telehealth only. And so you need to have that physical location. Usually homes don't necessarily count. And you also need to make sure it's secure. So a lot of insurance companies will do due diligence and see where your office is located. And if it's in some back alley or across the sales floor at a carpet store or something, then they'll reject you. So we will cover that in more depth in a future episode. But Carrie, when people's addresses aren't set up or properly, or they've got issues with their addresses on their contracts, what do you usually see on the billing side? So
we have seen situations where the insurance company reaches out to us and sends us a picture of the actual address.
Oh man!
And
really?
It'll be a picture of the person's home address or their home location.
Okay.
We've seen a few things like that, or the location is a warehouse type building or something to that effect. That just doesn't exist as far as having any kind of an office. So they start to deny claims when that happens.
Okay. So you will definitely want to have that in order. And then, God, I had another thought on that, but I can't think of it right now. Shoot.
Claim denial is a bad thing.
Yes.
Exactly.
That means along with a picture of a warehouse office. Yeah, that's a bad thing.
Yep.
So, someplace legitimate.
Yep. And so they're checking. And if you change those places, I guess to talk more about addresses, I mean, there's three core addresses. So you can have there's your business address. There's your service address, and that's where you would see clients. And then there's your mailing address. And so a lot of, we talk to some providers, not a lot, that want to use a PO box for their address for everything for privacy's sake, which makes a lot of sense. But that does not fly because you can't see a client in a PO box, unfortunately. And then the other
that
big
could be really small,
very small clients. Yeah.
Okay.
You'd have to be a very small provider too.
Yes. A very big PO box.
or a very big,
yeah,
good point.
Very big, yeah.
Maybe that'll be the name of our virtual office. This is a big PO box. So the other thing we see sometimes too is providers don't realize that their home address is public. I know we've come across that quite a bit at Breezy, where you go look up an NPI or go check the Secretary of State site, and that is public information. So for anybody who wants a little bit more privacy or that another level of separation from their clients, you just got to be aware of places where the business office or the service office do exist. So important and a very important consideration. And then you also want to try. We always preach when we're contracting for people that whatever you want to have it be relatively static until everything's settled out. So there's a lot of moving parts in contracting, and so whatever you do choose, you want to be sure that you can keep it that way for a good year before you make any changes to that. And that's the other hard part of that too. Once you have some office space and you've thought a little bit about addresses, the next step, I guess, is to register your, and I say I guess because you got to come up with a name, of course. So figure out what you're going to call yourself. But you'll want to register your business entity with the Secretary of State and the IRS as well. So you got to figure out all that financial business stuff. And so, first and foremost, and I'll say there's been a lot of confusion. I don't know, Carrie, you had any anecdotes or anything about just some of the confusion people have about their business entities, or really like filling out a W-9, which is it's a one-page form from the IRS, but boy, every little checkbox means something, doesn't it?
And it's surprising when you register for your business, you think you know exactly what kind of a business you have. And you find out when you're filling out that W-9, that is not true.
Yes. Yes. Or the payers will find out.
Or they're just not quite certain exactly what the situation is. Yeah, what their business is.
And so before we get too far into that, always check with your CPA or your financial advisor on any financial or tax related advice, because this business entity part of it is important, and there's a lot of legal rulings. So you always want to make sure you talk to a licensed professional or somebody who really can speak professionally on this. We've got some best practices that we've seen work, but we're not CPAs or anything. And the other thing too is like it costs a little money usually to do stuff like this, but to have to have a professional do this work we just highly recommend it. It's worth it in the long run. It's like a little pain in the beginning for a lot of gain later on.
I just want to add, starting a business and being a therapist, I know from my personally speaking, I'm not the numbers guy or the accountant expert or anything like that. So it is really worth the money to get an accountant if you don't have one right now.
And pretty soon we'll say it's worth the money for a lawyer too, won't we?
Well, pretty soon.
That's a later step.
There you go.
That's not when you're in trouble, though. This is
not when you're in trouble. No, that's not. Get yourself set up right so you're not in trouble. Pay a little bit to the lawyer now, so you don't have to pay a lot later. But what we've generally seen work the easiest with insurance companies for providers is, get your LLC registered with the state and then go file as an S corp with the IRS. Now you don't have to. I just know on the contracting phase, there's less questions to answer, so things run more smoothly. When you're, insurance companies are huge organizations, and they're just used to dealing with other larger organizations. So the more you can look like a corporation, like an S corp, it just flies through their systems better. There's a lot of problems. Sole proprietors, which means you can't have any employees. So if you're you don't have any legal protection. For $100, you get a lot of legal protection with an LLC, is my understanding. And so we don't recommend sole proprietor. Get yourself a tax ID. Don't use your social security number, for Pete's sake. That gets blasted all over the place, securely through claims, but it is on every single claim. So you really want to keep your social security number as protected as possible, which is why we always recommend a business tax ID as well. And also sole proprietors can't get group contracts. And so at Breezy, in addition to that, it's a huge pain in the backside for sole proprietor to get contracts. It's also a pain to bill under sole proprietor contracts because you're billing using an NPI-1. All these insurance companies want NPI-2s. That's all they ever see. 99.999% of the time they're dealing with NPI-2s. So what insurance companies are expecting is an NPI-2. So for those little one-offs, there's a whole bunch of weird stuff that happens on the billing side, and there's weird ways that you need to submit claims, and they're just not used to seeing an NPI-1 as a billing NPI.
So the NPI-1 is an individual NPI and NPI-2 is a group. Can you as an individual have both? You guys know?
So not as an individual, no. And the way I've explained NPIs a lot And so this kind of gets into our third point here is like obtain a national provider identifier and specifically a group NPI. So again, Breezy doesn't work with anything but group NPIs, or at least we're not taking on new customers like that, because the NPI one is kind of like a social security number. It applies to the individual. So that's the individual human being doing the therapy, the person. The NPI2 is for the group organization. So that's for the business. So that's also why a sole proprietor doesn't work, because there's no real group organization there. So you can't get a group NPI if you're a sole proprietor. There needs to be a business entity that exists to which that group NPI applies to. And then if it is a group, then in the future, so you can be a group of one if you want to be, but in the future with those contracts, if you do decide to expand or add on a partner or something like that, you can do that with a group contract much more easily. Otherwise, you got to convert, and it's a huge pain in the backside there too.
And that's what I was going to mention. I feel like sometimes people sign up for just their NPI one and don't want to set up as a group. And very shortly after that, they find out they do want to be a partner with someone else.
Yep. And then
then they have to readjust every single insurance contract and make changes to participation with insurance and different ways of contracting. So it's a lot of work that goes into those changes.
Yeah, you basically are starting over, aren't you?
Yep.
Yeah.
Exactly.
Okay. So to get your NPI2, all you do is log in to NPES, NPPES, log into NPES where you with your NPI1, and there's a button that says apply for NPI2 or apply for group NPI. And so you can go there, put in your business details and fill that out. Our sister company, Phoenix Credentialing, can also assist with that as well. So we've definitely helped a few people make that request. All right. So number 4 then is secure insurance coverage. So professional liability is a must. You can't get contracts without that. Generally, that also includes malpractice insurance, but it's also good to double check. And then general liability is sometimes required. UCare, specifically in Minnesota here, is one of our, it requires general liability. All are a good idea. This is another topic that we will be covering in depth in a future episode.
Can I just cover too a little bit? Like if you do have an office, you're going to need some kind of renter's insurance, or liability for, if somebody trips and falls or whatever. And that's different than professional liability, etc.
And is that like if you own it, or also if you're rent?
I think if you rent it, you need renter's insurance. Yeah.
So the 5th thing then, once you've got your insurance stuff taken care of, is getting contracted. So everything 1 through 4, that needs to kind of be in place and ready before you can start applying to contracts. So Carrie at Phoenix, that's kind of the core of what we do. What are some of the things that you've seen around, around the contracting aspect of this?
For the contracting aspect, sometimes it depends on whether the provider is already credentialed, which step that you can do first. If you can get the contract after they have been credentialed, or if you need to credential yourself as a provider before being able to get the contract.
Okay.
That varies.
And what is a way that someone a provider will know if they're credentialed or not?
The main way is if they've ever worked for a company in the past that they have participated with that insurance. That means that you are credentialed with that insurance.
Okay. So basically, if you've already billed it under your own license,
yes,
you can assume you're credentialed. And then, I know one of the other things we run into is credentialing accounts. So in Minnesota here, which is where most of Phoenix is currently working, there's Minnesota Credentialing Collaborative and CAQH. And I know in other states, CAQH is really the big credentialing one. So, how does those credentialing accounts work? And should people, should the individual providers maintain those, or is that like something the group does?
Sure. For MCC, Minnesota Credentialing Collaborative, that's for several Minnesota insurances. I wish I could name them all off the top of my head. I cannot. I believe it's 6 or 7 of them. Yes. And that one, the provider needs to set up their own account because it is a paid subscription, generally for a 3-year period. So it's best if they set up their own information and they fill out all of the details, everything from their social to their insurance to everything.
Yeah, that's about $75, I think, for 3 years.
Yep, correct.
And yeah, filling it out isn't too bad, especially because once you got it filled out, it's done.
Right.
So that's
then
good.
It's just keeping it updated every year and making sure that you update your insurances and things like that. Upload the new policies.
Yep, for sure.
That's important.
Yeah, those certs and then your license too are the two big ones that those get updated every year.
And the malpractice insurance. Yep.
And that is the case in both MCC and CAQH, that you need to keep them updated year to year. Yep. Because CAQH, all of the other insurances are actually reaching out to them for the information.
Mm-hmm.
That is nice for CAQH, so you don't have to do any recredentialing. And in Minnesota, it's Optum is the big one that uses CAQH. And so that's your Medica, United Healthcare, UMR, Surest, some other smaller ones too.
So historically speaking, I'm just going to say as a therapist.
Yeah, let's get a little history here.
So CAQH and MCC, entering that data once, and then keeping it updated. In years gone by, years ago, we used to have to fill out paper recredentialing applications each time and fill out all that information again and then send it in by snail mail and everything. It was a nightmare. So that is one thing that is really pretty nice these days.
If you like paperwork, you still can.
Well, okay.
That is true.
But we don't recommend it.
No.
That takes a lot of time. If you've got that kind of time on your hands, then I wish I was you.
Right.
So credentialing and then contracting and all that stuff has to be in order. And then not changing. One of the things we've done at BreezyBilling is if you are making any changes to your insurance companies when you're first starting out with us, then we actually charge a fee for that if you want to add a payer afterwards, because just changing things as you go, it's a very complex system. And so anytime you're adding more dirt or grit or changes into that system, it gums up the gears very quickly. And then it can take a year to unravel that mess sometimes. So once you're set, stay set for a while, change everything at the same time, and then wait for all those things to be completed, all those changes to take effect. And then if you're going to make any other changes, do that. It's really hard to keep track of things. And can really mess with your billing if you're making a lot of changes constantly. So that's like the core starting point there. We've got 5 more steps to get through. And so these next 5 steps, I kind of split this off here. And Carrie, let me know if you think this is a good split too. But while that's all going on, that's when you can start working on some of your, your business. So you're getting your business set up with all the insurance stuff and and like the IRS, all the entities out there that you need. Next is we get to talk about you. So Carrie, can you talk a little bit about how to set rates? I know we get this question a lot, like how much should I charge for an hour of psychotherapy? What do you recommend?
My one recommendation is always make sure to set your rates above your highest reimbursement from insurance. Of course, at this point, you're not going to know all of your reimbursements from insurance. So another way to do that is to consider what Medicare's allowed amount is for each code that you have. If you look to that information, it's easy to set it a certain percentage above Medicare's rate. And if you end up after the fact getting paid over 100 or 100% of your charges for any insurance, that means you're not charging enough and you need to raise your rates.
Right. and the insurance companies will adjust to their rate when they pay you back. That's for sure. So
and when we dive deeper into contracting, we'll talk a little bit more about how those rates work, because every insurance company has different rates and different rules. And they follow some general guidelines, but it can be a little bit different. So Carrie, how do you find the Medicare rate?
There's actually, the fee schedules are available online. You can search for it through just by even looking under Medicare physician fee schedule. You'd be able to go in there, and then you can look it up by your state's, what is it called?
MAC?
Okay. Your state's MAC.
Medicare Administrative, I can't remember what that stands
Administrative Contract. Yeah, I can't remember myself.
C.
Yeah. So you log into Medicare, you go to your state's MAC, and then you can look up each code and see exactly what they'll allow for that state.
Okay. All right. And then I know there's, and then you'd said you want to keep rates above what any payer would necessarily pay. And that if you're getting paid, if a payer is paying you 100% of what you asked, you're undercharging.
Absolutely.
And that gets into something I've been thinking about a little bit, is that, therapists, I think, sometimes undervalue what they're doing and the service that they're offering and the amount of school that they went to and how much investment, in time and money and just emotional investment too, in what they do. So definitely, you're worth it. You're worth it, therapists and providers. And then I guess the last thing I'd want to mention is the sliding fee scale too. And we'll touch on this a bit in the next one, which is your essential client forms. But if every therapist should have a sliding fee scale. Like if you're going to discount anybody, there need to be rules, and those need to apply to all of your clients fairly. And that is, in fact, that's contractually obligated with the insurance companies. As they say, if you're going to give anyone discounts, then you need to have a policy for that. So, so I guess we can jump into number 7 is, sometimes it's called intake paperwork, otherwise just your client forms. But I guess, Dad, how'd you come up with your intake paperwork?
I probably borrowed it from an agency before I started mine, and then I've been refining it ever since, basically, I would say.
And did any lawyers look it over?
Oh, I'm sure at one point.
Okay, all right,
or maybe not.
And I'd recommend it. And I know there's a few lawyers out there who will give you a package deal of intake paperwork, and there are some who will customize it for your practice based on how you want to operate. And the main thing is you want to make sure it's very clear and sound how you work and what your relationship with your client is going to be, which is why we definitely recommend talking to some kind of a professional for that at some point. But let's see, what do you all include in your intake paperwork package?
Well, I was thinking the consent for treatment is probably the biggest one. And I have very small print because I like to keep it on one page. But there's a lot of things that go into it, from your billing to emergencies to cancellation policies to compliance, HIPAA compliance. And then I also put permissions on there about, check this box if you want appointment reminders or an email reminder or the portal. So,
and consenting to that too, because it's not HIPAA compliant.
Right.
Yeah.
Right. The other thing that's important is if you're billing insurance companies, I have a statement on my insurance form that I have people sign that basically gives me permission to send the insurance companies the clinical notes if they ask for it. Mm-hmm. And they're, insurance companies basically will have the right contractually to audit your notes if they want to. So it's really important to have that on that form. So HIPAA notice, notice of privacy practices, the financial policies is really important.
Do you guys have a telehealth policy?
Yes.
Okay.
So if someone wants to do telehealth, we get a consent for that too. Yeah.
And I remember the COVID the COVID consents too from back in the day.
Yeah.
So what's required can change. And then what's there's a new one or newer one with your just your financial policy. Which one was that?
Financial disclosure form.
Yeah. Can you talk a bit about what you had to do for that one? Are we digging too deep? It's been a while.
Well, it's providing, and this is tough for mental health, but it's medically speaking, a hospital or a clinic is supposed to provide you with an estimate of services, of the cost of services. And so we have the form. We can talk about it with the clients, but it's really hard until you get into it more about how long you're going to be seeing the client and then what the cost might be. Mm-hmm. So, but we're very clear on the per hour cost, and setting the clinical notes up so they have goals that they meet. Yeah.
All right. So Carrie, you got anything to add on the documentation side or anything?
Well, just that depending on the software that you have, you can build it into your patient portal to be able to get that information filled out.
Yeah.
Any kind of forms people need generally.
Okay. And we can get into our next point there, which is, you're going to need some kind of a practice management system or EHR. And so typically that's part of the client portal that they go and sign in on. And so we also have a practice management solution that we call Breezy Notes. So we know a little bit about the software that'll help you, work every day. And so, Carrie, what are people looking for in a good EHR, a good practice management solution typically?
My first choice being from the billing end of the world would be to say, when you're choosing your software, please consider that it works for both the clinician and the biller.
Yes. And especially, a lot of people who are starting up their practices, they are both, and or they work with a company like ours.
Yep.
But
there's a lot of software that are really strong in one or really strong in another, but they're not strong in both. Mm-hmm. So that's an important thing to consider.
And most of the features there you're looking at is telehealth. And there, can you do your scheduling, appointment reminders, documentation? I'm kind of listing like the core items of like what Breezy Notes offers and what pretty much every other practice management solution offers here. The accounting, because you have to deal with the money stuff, reporting, so you can see, have a good vision on your clinic. What do you get in that client portal where clients can log in and what do they see? What can they do? Can they pay their bills? Can they sign their intake paperwork? And then all the way to the billing is, how does it manage the claims, the denials, the rejections, all the, the payment posting? How's all that handled? So you want to kind of take a whole look. And again, we'll probably have multiple podcasts about different parts of this in the future, because that's one of the two major things that we offer here at Breezy as well. So these are some of the core systems. You've got things that you need. You got your office space. You got your rates, your forms, your practice management solutions. You get those contracts in place. But you're going to have to do a little bit of marketing of some kind. Like you're going to have to let somebody know that you're getting, that you're ready to take clients. And what a lot of those clients come, referred from the insurance companies too, based on location. Can you talk about, so we're going to talk about websites, we're going to talk about mapping services, social media accounts, referral sources, all that kind of goes together. But one aspect of that is every insurance company has find a provider. And so Carrie, can you talk a little bit about those provider directories and, where to find them, and how to check how you are listed on there or when, and just get an idea of what clients are seeing when they're searching for you?
Sure. Every insurance has its own search engine that you can go through to find the different providers. You have to know all of the details of the client, or the client needs to know the details that they're looking for, which usually comes off of their insurance card, because as an example, Blue Cross Blue Shield has a million different plans, and not everyone participates in all of those plans. So it's important for them to be able to go into that site and find a provider that actually participates with their specific plan.
And I'd say any therapist could check their own insurance and see how they find a provider too, or go try and find another therapist and type in your zip code, put in your what specialty you're looking for, someone's name, just so you can get a feel for how it works. And then I'd say look for yourself too. Once you have your contracts in place,
Right.
you can definitely go try and dig yourself up and then see what it looks like. And, you know, I think do different, like some provider directories, you can like upload a picture to, even if you wanted to, right?
You definitely can. Yep.
Okay. And then it'll list your hours. And this gets back to this what am I calling the soapbox that I like to get on is keep your details accurate. So if you're changing anything about your practice, it's expensive, which is why you want to have everything in place. But if you make changes to your practice, for Pete's sake, please let your insurance companies know. You have to get that updated with each of those companies. And it's every payer is a little bit different, but darn it, just do it. Otherwise, you can have billing trouble. You can, be missing out on clients. If you end up getting audited, that there can be some problems there, or at least, a slap on the wrist all the way to losing your contract, depending on what happened. So you want to make sure those things stay up to date. And that's with, if you're adding providers, changing locations, even just changing
adding
your hours.
Location.
There, adding locations.
Adding a location,
right?
yes.
Yeah. Or, don't move to a new office and then tell somebody, hey, by the way, I'm moving to a new office tomorrow, because it takes weeks to get this stuff done.
Yes.
So, but definitely check out those provider portals. You're going to want a website. You're probably going to want to at least get your social media accounts in order, just in case you need them, even if you're not using them. Mapping services like Google Maps, Bing Maps, what else is there these days? And then just get yourself listed on all those. And then, Dad, for the Jonas Center, what are some of the other things that you guys use?
Well, we use the Hutchinson newspaper.
Ooh. And the Jonas Center is located where?
We have 3 locations, one of them being Glencoe, which is rural Minnesota. And people out there still read the paper. So we have ads there. We may even do the yellow pages out there yet, although how many of you have seen yellow pages lately? Okay.
It's been a while.
It's been a while.
Yellowpages.com.
Yeah, probably that. We also utilize Psychology Today. And I've got both the Jonas Center on there and at least a couple of the therapists that we pay for their subscriptions to that. That's a good referral source. I think Good Therapy. I'm on Minnesota Fast Track, or not sure how many referrals we get from there. And then it is colleagues, word of mouth. Once you get established a little bit, the word of mouth is really important, and that's where keeping your reputation up and just doing good work is going to help with that. I'm trying to think if we do anything. Oh, I think we have an ad at the community center in Waconia that shows up on the screen every 15 seconds. Nice. Yeah. So,
and kind of funny, but the one thing you forgot to mention is you do have a website.
Oh yeah, we do have a website. Sometimes it gets updated in a timely fashion. Other times, the webmaster.
I'm still in charge of that. Yeah, I owe you a little work, Dad.
Great. Okay, so yeah. So there is that website.
Oh man, I had something I wanted to say on that too. The referrals and colleagues. Tell your friends, tell your colleagues, talk to your trade associations, because in our experience with our customers, everybody has wait lists and they are looking for good people to refer out to. So the whole networking thing is can be painful for some. But even introverts can do this, and extroverts can do this too. Like everyone, it's support yourself. And so let people know that you're open for business. The associations too. So I know, the MAMFT, and MPA here. most trade associations have newsletters that you can use. And that, it's cheap if you're a provider just to say, hey, I'm open for business, looking for referrals. And so, otherwise people you've worked with in the past, your supervisors from back in the day or from just yesterday, if you just got your license, all great places to go.
I think too, if you specializing in something, can be a real bonus too, or, your willingness to see people with Medicare, because there's a big need for that, and people who are willing to see kids. There's a big need for that. Those are other two. And then any specialty like EMDR or being a registered child therapist or brain spotting, those are all good things to have on your website.
Yeah. Well, and Medicare too. Everyone, all the all the licenses can do Medicare now. That's one thing that there's still a little lack of clarity, but whether you're a counselor, MFT, master's level psychologist, clinical social worker, all the licenses can now apply for Medicare.
And I'd like to add on to that, going back to credentialing and contracting, you need to do something with Medicare. You need to choose whether you're going to participate, not be non-participating.
Right. Yes.
And you do have to fill out some kind of paperwork to do whether you're going to participate or not participate with Medicare.
And Carrie, isn't it right too that a lot of insurance companies, you also need to be contracted with Medicaid? Is that
enrolled? Yeah,
or enrolled,
at least screened. Yeah.
In Minnesota, for sure, you are required to be enrolled in Medicaid in order to
everywhere.
Get everywhere else. All the other insurances to even consider you.
Okay.
Yeah. Yep. And I don't know how other states handle it, but generally the federal laws, you have to be enrolled in Medicaid. Like you have to be on the roster. You don't have to see Medicaid clients if that's not your niche, but you at least have to be in the system. I'm not, in Minnesota, it's enforced where the commercial payers won't contract with you until you are enrolled. So that's, when we're doing any credentialing or contracting work for people, that's the first thing we say is we're starting with Medicaid, and then we can start working on the other applications.
Yeah.
Right.
Yeah.
All right. Anything else?
Wow.
So those are 10 things.
All right.
And I'm going to run through them real quick for everybody. But, the first half is like get the business side set up. So it's find your office space, register your business entity with the Secretary of State and the IRS. So, get your tax ID, get yourself a group NPI. We highly recommend it. Get yourself some insurance and then get those contract applications out, or get credentialed and get the contract applications out, depending on where you're at. While the contracts are being processed, which is a months-long process. I don't know if we mentioned that. We tell people 6 to 8 months for getting the majority of your contracts done from the time you start. But while that's happening, that's where you want to set your rates, create your essential client forms, invest in your EHR or practice management system, work on your online presence, and then get those referral sources established. So those are the 10 things that you need to get done if you're starting a practice. We're here to help you all the way there. If we can't do the work, Breezy has a lot of connections. People here have a lot of connections and can help you with different aspects of that. So one of the things I always like to say when I'm on a call with a prospect is, from getting your tax ID to getting your taxes done, we'll help you out and try and guide you through this process. So that's my pitch. I don't know, Carrie. Carrie, do you have any pitch for Phoenix or anything and how that fits into all this?
The one thing that I'd like to say is that, yes, the credentialing and contracting process is a complex process. We've had more customers come in through trying to do it themselves and getting very frustrated with the process that they end up handing it off to us, and which can add additional challenges to it as well.
Lots of challenges. Yep. Even this guy, we got to help this guy here.
Yep.
I think
all of our
the Jonas Center was our first customer.
Yes, they were.
It probably was.
Just when we
I got a
launched the
discounted rate.
That's what you get for being number one, Dad.
Okay.
Yes.
Oh man.
Yeah. So it takes a lot of work. We've met some people who've successfully gotten through some contracts and they just decided it was too much work too. And for those folks, kudos, because it's a learning curve and there's a surprisingly large amount of bad information when you call and ask questions about this. an insanely large amount of bad information. So
Yes.
it was through a lot of hard work that our team was able to get that all put together when we built Phoenix Credentialing.
Yeah. I think having like Phoenix Credentialing and BreezyBilling really, it's those are agencies that can help you through this. And this can be a very scary and frustrating process. And just to have somebody there to walk with you, I think is really helpful. And like years ago, I did this all on my own. And the Medicare application, oh my gosh.
Yeah.
I mean, that's just amazing, along with all the other ones. So that's why I hired Phoenix to do our recontracting and taking a look at it, because I didn't want to do that. So Stella did a great job.
Oh, yeah. Awesome. And we're going to hopefully have her on here in a future episode too, to talk more turkey about that.
Yeah.
All right. Well, good show, team. Before we go though, we asked this outro question of just about everybody. It's what have you been thinking about lately? So what's been on your mind this time around? So Carrie, got to ask you, we always start with the guest. I guess maybe we should make the guest go last. So she can have a little time to think about it. But we're putting you on the spot now. You're first in line on the script we have here. So Carrie, what have you been thinking about lately?
Well, because we've had a little bit of rain and some difficult nights on, let's say, on my league nights, I'm thinking about weekend weather and golf.
Okay, yeah.
Do I ask how you've been hitting lately?
I've been having fun.
Good. Good.
So she hasn't given it up yet. That's what I'm hearing.
No broken clubs, I don't think.
Hate a hole, love a hole. That's just the way it is.
There you go. I'm usually just hate a hole.
Oh, yeah. Oh, man.
How about you, Dad? What you been thinking about lately?
Just sitting here thinking about it. I've been thinking about sailing, getting on the right tack and going for it.
Oh, nice tie-in.
We've sailed twice this year, right? Or is it just once?
Just once.
It's just once. And we got about a quarter of a mile onto the lake and then back because there was no wind.
No wind.
And then we've committed to sailing every Tuesday night. And so far the weather, like it rained, this, that. So we haven't been able to do that either yet. But that's what I'm thinking about this Tuesday.
Darn it, this
sailing.
Tuesday,
Definitely.
Okay.
Nice.
And so the thing I've been thinking about is the meaning of life and
sailing.
Yeah. And really 42. So I turned 42 recently. And in the Hitchhiker's Guide to the Galaxy, that is the meaning of life, which generally means there really may or may not be meaning. It's whatever you put into it. So I've just been enjoying the fact that I can now say I'm the age of the meaning of life right now.
Nice. I love that.
I don't want to know what age that makes me. So
yeah, no, you're still. I'm still planning to be 35 until I die.
Okay, good.
Oh, there we go.
So you're still
Me
doing
too.
good.
Okay, we're all 35.
It was a great year. I think doesn't everybody have a year where like that's the year I'm going to stay that age? I'm not 20 and don't know as much or know a lot less than I think I know, and I'm not 40 where it's like my knees are starting to hurt after a run. For 35 was a very good year. I'll stick with that one, but officially, 42 now, but I'll roll with the Hitchhiker's Guide. That works.
Excellent.
All right. Well, so that's it. Thanks for your time today. And until next time,
well, keep your eyes on the horizon.
And big props to Carrie too for joining us here.
Thank you so much, Carrie.
Thank you for having me.
All right. We'll see you on the next one.
Yeah. Bye-bye.